a sort of a specialization of the Internet of Things. IoT, you're all familiar with that terminology. And 5G, so we all use 4G now on our phones and laptops. That's being phased out and replaced with 5G. Very, very different technology. And blockchain, which is the underlying infrastructure for Bitcoin and ephemeral other electronic coins. And how that all sort of culminates and coalesces to support artificial intelligence and IT. Actually, some of the things that Mark talked about, I think that you may see addressed with some of this technology. So these are three technologies we want to look at, sort of broke them up in separate parts, so we can take a look at how the Internet of Medical Things, 5G, and blockchain work with artificial intelligence to help healthcare. I really think this is, not something that's months away, it's years away, but it's in the making now, and it's something that I really believe will have should revolutionize the industry in a lot of ways. So part one is the Internet of Medical Things. So there's just a proliferation, a cornucopia of different vendors who are involved here. Large vendors, small vendors, that popping up, almost by the day with venture capitalists. So you might know some of the names there, like IBM and Novartis, but there are many others, and it's constantly changing. And so needless to say, when you have so many vendors, you have a lot of products, and it's just a small sampling. But there are some interesting things here, like a contact lens that has a chip in it to detect eye pressure and glaucoma. And these sort of digestible pills that can communicate with a patch on your body to validate that you took the pill. And then it goes to your iPhone or smartphone, and obviously from there it could go to a practitioner or a physician or your caregiver. If you're missing medications, they would know you're missing medications by that. I think this would be great for people who take psychiatric medications. They skip a medication. Okay, looks a little different here. Skip a medication, and people will know about it. Now you may have seen on television this little ECG or EKG, where you can sort of do your own little EKG and have it pop up on your smartphone, which is a computer, right? It's just looking at the algorithms. There are lots of different devices for prescription reminders, the little RX picture here. And this is rather interesting. This is the phones have an accelerometer in it. And the idea here is to look at the gait, the walking and the climbing steps of a Parkinson's patient. So you can, by watching the accelerometer, the physician gets some understanding of what the patient's symptoms are like, as opposed to just hearing that subjectively. And maybe even intervene if things look like they're deteriorating. So lots of products on the IOMT level, lot coming up, in a radically fast basis. Okay. It's not the button. Page down button. So this is something that should happen someday, right? The IOMT connecting to the Internet of Things. So things will be talking to things. And right now that's happens somewhat, right? You have like Alexa in your home, and so here's this woman on the scale. If you can't read it, bad news, the scale is threatening to cut off access to the fridge. So then you have things like this at home, right? You've got Alexa, you've got Google Home, they can talk to your lights, can talk to your wireless thermostats, and that's the thing in the future. Machines talk to machines. 5G will really support that very well. So obviously we all have electronic medical records, our institutions, we have physicians, but just think about the power of, and by the way, physicians, this top caption here talks about how physicians, more than 51%, it's a little hard to see on this slide, but the green bar, more than 51% like alerts, like reminders, they feel they're valuable. On the bottom is a low number, 14% feel it gets in their way, it might be distracting. I'm not sure what your opinion is of that is, but all in all, physicians like the idea of having automated alerts. So imagine having electronic medical records that you have now in hospitals and physician systems feeding these EMRs, but imagine what would happen when the Internet of Things is feeding those as well. So there's biometric trends, alerts, things that can happen during the day that you only have an opportunity to talk to your physician for a few minutes about what your symptoms might be. You may forget what happened a day or a week ago, but these machines will be tracking this, looking for trends up or down. And a caveat I have here is obviously EMR data integration still presents many challenges. So there will be I'm sure there'll be multiple systems for a while and alert systems that are independent of the EMR, but as time goes on, you'll see these Internet of Things feeding these EMRs. A lot of opportunities for EMRs to collect that continuous data on patients. So here, this slide sort of summarizes a bit ambulance critical care. A patient could go into an ambulance and they could look at the phone and see what's happened the last hour, last day, last week. Look at the trends. Follow-up care, preemptive care, continuous monitoring. Maybe having these continuous monitoring biometrics will help with diagnosing the patient. And certainly, treating. Like even now we have, implantable devices for diabetics that if you make this Wi-Fi connected, now not only is the patient looking at maybe on a smartphone or on a computer what's happening, but an alert can go to the provider, to the caregiver about what's happening with their blood sugars. And then here's sort of an integration of a biometric that's sending a code blue and your address. So integrating the biometrics with the GPS so people know where you are. If you're hiking, you're in a park, you're on a boat, and something happens, someone can actually find you. So a lot of opportunities. It's great that Mark talked about pharmaceuticals because to segue to some of the things here. According to IBM Watson Health, about 80% of the patients that could be participating in clinical trials don't. And it delays trials, it causes trials to fail. But the Internet of Things now gives you the opportunity to get a patient who could be a potential participant in a trial. It takes the burden off of tracking. The device can track a lot of the information that they have to track manually. And then the other part of it is it's empirical, it's not subjective, right? So the Internet of Things will have the opportunity to collect data empirically, make it easier for people to participate, and hopefully increase the participation in clinical trials and have fewer delays and failures. So lots of growth in the Internet of Things, as you can see with this chart here. But 2020 looks like we're looking at about $50 billion worth of devices. This is just the United States alone, I should say. But this will overwhelm the 4G telecommunications, which is why you're hearing a little bit more and more about 5G. So 5G is part two of this conversation here. 4G right now, you have somewhere 15 megabits per second uploads and downloads. 5G, you'll have at least 1 gigabyte. Certain situations, you could have 10 gigabytes. So you're talking about a tremendous amount of speed, almost really no latency. So it's really good for alerts and for physical biometrics that want to engage your caregiver quickly. High density. It says high density meaning you can have about 1 million nodes or 1 million devices in a per square kilometer. So that's a lot of density and extreme overall capacity of about 10 terabytes. So 4G could never accommodate this, but 5G will, which is beginning to be rolled out slowly, and you'll see why it's slow. But in the long run, we'll all be better off. So this slide's a little busy, but on the left-hand side, I could have sort of summarized the advantages of 5G. Be very fast for uploads and downloads, virtually no latency, no waiting time. Accommodates a vast number of devices. Mobility, you could be traveling about 500 kilometers per hour and switch from antenna to antenna flawlessly without losing any data. So that's another big advantage. Machine-to-machine communication handles that very well. Actually, it's going to be very expensive, billions to roll out. But once it's rolled out, it'll be a lower cost per transmission. So 4G per transmission is less expensive than 5G is less expensive per transmission than 4G, but it's billions of dollars and years away. And very low power consumption. So your devices, the battery life will last a lot longer. So a lot of advantages to 5G. Now, if we take a quick look at this, look at the right, first we'll get to the bottom line of this first. It may take about 5 years to cover 50% of the United States with 5G. The good thing is devices will be able to switch back and forth between 4G and 5G. So if you hit a 5G cell, you can take advantage of it, and you go back to 4G in those areas. So very quickly, if you look at that top antenna, these big macro cells of 4G, they could go up to about 20 miles in terms of coverage, depending on the height, half a mile to 20 miles. And you may have noticed in the last several years in your neighborhoods on top of telephone poles, you might see these tall metal cylinders that look maybe a little bit wider in diameter than the telephone pole itself. Those are these little smaller cells to cover areas that have a weak signal. And those can have 500 to 1,200 feet. 5G you need a lot of antennas. They only cover 200 to 750 feet. So there'll be millions of these. There are estimates there'll be hundreds of thousands just for New York City. Now they're not large, so they're rather inexpensive and they're not as problematic to install because you don't need a big giant antenna. You can put them on top of the telephone poles. But it's going to take years for this to really be deployed. But you can do an internet search. I don't say Google anymore. You do an internet search on 5G rollout, and you see all the vendors rolling it out in various cities. It is being rolled out, but it'll take several years before you really see an impact. So we talked about the first two pieces of this, the things themselves, the devices that will collect continuous biometrics, and we talked about how 5G can accommodate that. Now let's talk a little bit about blockchain. So blockchain is going to be important for this whole picture because, first of all, blockchain, I'm not sure if you're all aware, that's the underlying technology of e-coins, Bitcoin, ephemeral, or a lot of different e-coins out there. Blockchain is the technology that creates the coins and calculates the validity of them. And it became obvious to some that we'll see in a minute how it works. Very robust security, very strong data integrity, can't be changed easily, and it's very highly scalable. Now it doesn't correct the problem or the weakness of attacking the internet itself. Actually, today's the anniversary. 3 years ago, we had a huge internet infrastructure attack that took down for hours Netflix and Twitter and lots of large sites, news sites. And it had to do with when you type in Hofstra.edu, it has to go to a server called the DNS server, domain name server, and that server translates Hofstra.edu to a number, to an IP address, and that can be routed through the internet. Those domain name servers were attacked with what they call ping, an attack that sort of drained all the resources so no one could get to that domain name server. So unless you knew the IP number to key in, you couldn't really use the internet for several hours for most sites. It doesn't solve that at all, but it does create a repository or an accounting ledger that's very secure, very hard to change, but it doesn't really solve the problems that we have with the internet. In fact, the Internet of Things can cause, hackers can use your Wi-Fi thermostats. You may have heard this, your thermostats, your cameras, anything associated with Wi-Fi connected to the internet. Hackers will use those to create attacks. So the more of those you have, and we're going to have a lot more of those of Internet of Things, you're actually creating a bigger, sort of attack surface. But, that's part of progress. We'll have to deal with that separately. So many industries have seen this underlying technology as a way to change their own, the way they do business. It's scalable, it's secure, data integrity, and it creates a lot of efficiency. So we talked about middlemen. There's no middleman when a Bitcoin gets created. It's created by the individual participants, the nodes, the miners, if you heard about internet mining. And internet mining is a way to sort of do a calculation on each transaction and validate it. And you get a little tiny fraction of a Bitcoin. So this could be used in any industry, not to pay with a Bitcoin, but maybe it's a loyalty program, or maybe it's a discount on your deductible for healthcare, or maybe you don't want to participate, or maybe the hospitals will create these nodes. These business models will mature and they'll be a little bit different, but there'll be some computers, peer computers, have to do this calculation, right? I don't know if we have time for a 5-minute video here or not. That's coming up, but I'll ask our hosts. But blockchain can do a lot more for healthcare to streamline and improve things in addition to helping the Internet of Things. So, for example, the EMR. Patients can control the EMR much more with the blockchain technology. More comprehensive EMR, obviously, as it's collecting all this information from Internet of Things, will be more of a continuous longitudinal record for patients and that they have control over. We talked about fraud in the pharmaceutical industry and poor ingredients. So there's a chain of custody for pharmaceutical ingredients, China, India, etc. You can really sort of track right down to a batch. So the blockchain will be able to control each transaction, each batch of ingredient from each source. So if there is a problem, you can go back and figure out where either the efficacy was bad or was it pure. But you should be able to go back and do a very finite recall and know who the guilty culprits are. Again, eliminates sort of middlemen, hard to explain all of this in one sitting, but much more efficient procurement with smart contracts than a peer-to-peer, taking out the middlemen from all of this. Similarly with blood and organ transplant inventory. Very much organizations can talk to each other on blockchain about what their inventories are. Similarly with credentialing, providers get credentialed here in the United States. The credentialings even vary from state to state. We've had situations where a provider has had a problem in one state, another state doesn't know about it, and they get licensed and they get privileges in a hospital. So institutions will be able to communicate directly with each other and quickly internationally about provider credentialing. So it's on and on, billing, payment, all that middleman paper, all that sort of some of the things that our good doctor here has suffered. A lot of that should be streamlined with blockchain. Disaster relief, for human capital and supplies as well to be located, for transport. So there's a lot blockchain can do for any industry, and particularly these are the kinds of things that you can apply to the healthcare industry. So this is sort of how blockchain works. How are we doing on time? How much time do we have for this presentation? I don't want to keep people late.
I'm looking for the time.
It's supposed to end what time?
You got 15 minutes.
15 minutes? So essentially, whether it's a Bitcoin transaction or whether it's a medical record transaction, whatever they are, they get hashed. Now, a hash is really just a summation. So if you take all the ingredients, if you take the person's name, you take the dollar amount, or the medical record information, whatever it is, and bring that down to the binary zeros and ones and add that all up. That's what the hash is. It creates a fingerprint of that transaction. Transactions get hashed. They get hashed with other transactions in this what's called a Merkle tree, and the transactions build up to a block. So there's a very specific signature for that block based on those hashes. But the beauty is, well, there's also a timestamp and a sort of a random number. But the beauty is, when this hash gets created on block 49, on block 50, it gets added to the next block. That's why block 50 has the hash from block 49. So it creates a chain. So if you try to change one of these transactions, you're offsetting this block. The hash is different. It's wrong. And it'll throw out all the following blocks, because each block has the previous hash from the previous block. That's why it's called a chain. So it's very secure in terms of somebody trying to tinker with your medical records or tinker with your banking information. Whatever blockchain is used for, it's very difficult for a hacker to change that transaction. Almost impossible. So this is what I said earlier. There's no middleman. Here you have Alice doing some sort of transaction with Bob. All of the computers in the circle here are participants in this blockchain. And they're all allowing their computers to do these little hash calculations and validate when a new block comes in. That's why there's a big check box in the middle, which means consensus. They're all agreeing that everything's in balance, that all the hashes match, that somebody just added a new block to the chain, no one's changed anything, and you just keep adding blocks. And again, all these nodes right now, if you take something like Bitcoin, to let their computers, they allow their computers to help in this peer system to do a little calculation of these hashes and validating hashes, and they get a very tiny piece of Bitcoin. Again, you can take it away from Bitcoin, put it in a banking situation. Maybe the banks have the nodes, maybe you have 50 or 100 or 200 banks being the nodes, or maybe you have individuals participating. Again, that'll be worked out. If it's a medical record, maybe it's physicians' offices. Maybe they pay a small percent, or maybe they get paid nothing. Maybe they just let their computers do the work, and they're not paid anything for it. Is that a question? Yes, sir.
Yeah, one of the knocks on blockchain is, as you can see, it's very processing intensive, and therefore the number of transactions per unit of time is strictly limited.
Yes, well, that's done intentionally. So you talking about the 10-minute calculation?
I don't know. I'm just talking conceptually.
Okay. There is, well, I think people feel that it will be more effective and more efficient, because if all of us are in business together, or we're all trading whatever we're trading, we're all contributing to something, whether it's banking, or whether we're all practitioners in creating information about this fellow right over here, his medical record, or her medical record on that end. If we're all contributing to that, and we're all letting our computers, as we work looking at EMRs and adding information to EMRs, if we allow our computer to do the hashing and do the validation on the hashing, there's no middleman. It's none. The practitioners are just doing it themselves. So it literally takes the middleman out of the equation. for many things.
But instead of being able to process hundreds of thousands of transactions a second, it's just like a couple of thousand transactions a second.
No, that's not true. Well, it depends on how many nodes you have, right?
Yeah.
I mean, so what they did do intentionally in blockchain, it takes literally 10 minutes to add a block.
Yeah.
Now, it doesn't mean that there isn't parallel processing. There could be millions of blocks being calculated, but it takes 10 minutes for a specific reason. So if somebody did try to change a block, they've got to change, it's 10 minutes per block. That chain could have 10,000 links in it, or 1,000,000 links in it. And you've got to recalculate every single link for 10 minutes each is impossible.
Yeah.
So maybe that's where what you're hearing, I'm not sure.
Well, I'm just saying, consequently, your throughput is limited.
Not really, because the number of nodes doing calculations is unlimited. You could put a supercomputer on doing calculations. I mean, they didn't do it for Bitcoin because they didn't want a middleman. There's no bank, there's no central bank for Bitcoin, right?
Yeah.
It's just millions of people who are trading and buying Bitcoins. I don't think there's a problem with the processing. I think maybe what you may have heard is that 10-minute calculation, but when you have millions of computers doing this, it's done in 10 minutes, there's no middleman. I mean, it's quicker than trying to get information through a middleman and back somewhere else. I mean, it's going to threaten a lot of business models. Just the way the internet has sort of revolutionized many models and a lot of brick and mortar things went away, I think you're going to see a lot of middle tier activities disappear because of this calculation being done by the participants themselves. I'm not sure if that answers your question, but...
It wasn't a question, it was a statement.
Well, maybe we can agree to disagree on it. Okay. I don't know if you have time for a video here or not, but we may not have time. But if you just do a search in YouTube, how does blockchain work, or how does a blockchain work?
Is this the humorous presentation?
No, this is legitimate. Sorry.
Okay.
So we probably don't have time for this, but I'll leave it to you two guys to go to look it up. It's a very quick explanation of how blockchain works, because I probably butchered the explanation. So now, one other thing that happens when you have these technologies working together, many Internet of Things, 5G, allowing tons of data, terabits of data to be moved around, and blockchain securing the transactions, there's going to be a lot of big data and bigger data. So that's a problem, because providers will see a tsunami of data. I mean, we won't be able to keep up with it, because any one person who's had maybe just one or two IOMTs on them, that data, somebody's got to separate what's important, what's not important. You can't, they'll be overloaded. But the good news is, artificial intelligence, as we all know, loves big data. The more data, the better. And AI is useless without big data. So there's an advantage that we can leverage to solve the problem. So let's talk a little bit about artificial intelligence. So again, you'll have this sort of centers all of the devices that may be collecting information. This is a solution that Amazon's building right now and proposing as a way to help accommodate this. So you have to organize disparate data, right? Different sorts of data from different sorts of vendors. There may have to be some sort of standard, like a new kind of HL7 for IoT, some sort of data standard to handle the structured and unstructured data that these devices will be feeding. But how do you figure out who the outliers are? How do you know what to pay attention to? Where should the alerts be? How do you follow up with a patient? So Amazon is trying to build, and others, not just Amazon, but they partnered very early, and I have another video here with Philips, Philips, the medical imaging company, and they're building a whole cloud service for this purpose. So these devices would feed their clouds, the clouds would make sense of the data, and the alerts would go to the caregiver or the family appropriately without flooding them with continuous data, most of which may be unimportant. The third thing you can do after the data is sort of integrated properly is help with medical decisions. Advice, alerts with advice now, as opposed to just an alert. Predictive analytics. Who will likely have a heart attack or develop cancer? Support a difficult diagnosis. Obviously the amount of data that's being generated from research, medical data, no human being can keep track of. You probably can. We'll make an exception. Humans can't do it, but computers obviously can. And there's been a lot of studies about imaging diagnostic results. You'll get it in the future. You'll get your image. You'll get your results from your MRI or X-ray as you're putting your clothes on to leave the exam, you'll have your results. And it'll be better. It'll be better than a human radiologist because these systems can look at millions and millions, and there's already studies on this, millions of scans of whether it is an MRI. And they realize that when you look at millions of these, there may be a very subtle change that may not be in an image, that may not be perceived by a human. Or if they do perceive it, it may not seem consequential. But when you're looking at millions of scans and you see 10,000, that very small, almost imperceptible change, statistically, is a signal that cancer is going to develop in 3 years. A computer could figure that out. A human, probably can't. So you'll have better diagnoses and much faster. And there are a lot of vendors who are looking at this. So, there's Microsoft, Amazon, entities are very large, sort of like an AT&T in Japan, working with Google. And there's even Salesforce. For you folks who are familiar with Salesforce, that really is really a product that's used to keep track of your prospects when you're selling a product and what your close rate is, how often you get contracts. They're looking at a way to have a 360-degree of patient information. So they also want to, I put that one in there because this is a vendor that's got nothing to do with healthcare, but wants to get in on the action of healthcare with artificial intelligence. Now, Forbes predicts we've got about in a few years we'll have $6 billion, almost $7 billion in artificial intelligence investments in healthcare. In the mere 5 years, that should go to about $150 billion. So there's a lot of attention with AI, and there's a lot of data, and that is growing, and data feeds AI. Here's a PwC survey from a few years ago, 2017, and healthcare executives rated AI as the most disruptive technology, and right beneath that is the Internet of Things. As you can see, there's other pieces here that I think you can read. This is an interesting video also that you might want to go 4 minutes advance into it and watch it. If we don't have, do we have time today to watch this, or we're out of time?
4 minutes.
4 minutes on the roll? Okay. We'll do we'll jump to the, so this is the CEO. How do we get this to play? Why is this not playing?
Is it clickable?
This is the CEO of, well, this is PowerPoint. It should be able, when you do this, it should play. It's not connecting, we're not connected to the internet, are we?
Is it clickable? Is
It should be
blue?
clickable. Do
It
you
is?
have Wi-Fi on this? If the Wi-Fi is not working, it won't be
Jeez.
clickable. All right.
Yeah, that's probably what it
Yeah,
is.
there's
You
no
got to
connection.
sign into the Wi-Fi.
Yeah, that's all right. We can.
Yeah, if you're not signed into the Wi-Fi, then there's.
Yeah, you need to connect to the internet to pull it up. Well, I can. We can do it on time. I'll hold you guys later if you have other appointments.
If you send me the URL, I'll send it out to everybody.
Yeah, I will. He has a copy now of the PowerPoint.
Okay.
So if that PowerPoint, if you load that PowerPoint on any PC, laptop or device, or even a phone that's got internet, you'll be able to see it. So this is the CEO of Philips, and they're partnering with Amazon and others, and they're going through a number of different sort of revolutionary changes with Amazon, trying to figure out how to put your arms around all this data coming in the future. So it's a rather interesting video, and he does talk about imaging, and he touches a little bit upon the quality of imaging, but and AI and how when you have millions and millions, he has some bizarre, I think there was a statistic, I'm sorry we can't get it to play, the amount of data that Philips adds internationally to various databases is in the petabytes a day. So you need something like very scalable, like a cloud technology to be able to handle all this. And an engine, something like an Amazon or Microsoft or Google would be able to accommodate this sort of stuff. But it's a really interesting, you can listen to the whole thing, it's about 7 minutes. If you skip the first 4 minutes, he talks a little about his own personal, he has some high blood pressure in his family, etc. I didn't find it that interesting. Now you can't talk about AI without talking about this guy, right? Elon Musk. So he's everybody knows him, Tesla, SpaceX, lots of things. He's digging a tunnel through LA, and he has this company called Neuralink. And what he wants to do is to have BMI is going to have a new definition now, a brain-machine interface. So he feels, and he's probably right, that when we interface with our computers, he says we're all cyborgs. And we, you know, this is what makes us a cyborg. But the interface is slow and sloppy, typing, maybe talking, it's still real slow. So you need something like in your brain, physically, that connects to a device, that talks to a computer, to give you this enhanced capability. But he's being modest about it. He says he wants to increase the order of magnitude, the number of neurons, you know, through having an interface with a computer. And he wants to look at critically unmet medical needs for patients, which is probably a good place to start. And he wants to make this as simple as LASIK. I love this guy, he's such a salesman. It's going to be LASIK. Put something in my brain that's like LASIK surgery. But they do have a chip, and there it is, an N1 sensor, and here's how it would get implanted. And I guess they say for Parkinson's disease, you may know more about this, they have these similar devices that have maybe 10 electrodes. There'll be 10,000 electrodes with this chip. Very sophisticated. And it really communicates with, I imagine it sticks with a magnet, maybe there's a little pod that goes behind your ear, and that communicates with your phone, so you can have the ability to actually make adjustments and do various maintenance on your brain. So they want to start with Parkinson's and spinal cord injuries, but eventually, you know, brain enhancements. Now, where that takes us down the road, you know, who knows? But it's not. You know, it's going to happen. Toothpaste is out of the tube. There's no stopping this technology. And they already have monkeys with these implants that can control a cursor on a screen by thought. So the monkey looks at the screen and can move the cursor over to a banana and various things. So he's going to get there. You know, it might be in our lifetime. So I just wanted to throw a little bit of Elon Musk in here when we talk about AI. And this may be the solution to the fears that will be replaced by artificial intelligence, right? That we won't be able to keep up. We'll be like so primitive to an AI machine 50 years from now, there's no need for humans anymore. But if we're cyborgs like this, maybe there is a way to keep up with this. And then he actually has, anybody listen to Joe Rogan? You have to be doing, oh, okay, there you go. You have to be, see, a young guy, right? The interesting thing is these Joe Rogan interviews are 2 or 3 hours. So I first heard that, I thought, I'm not going to listen to it, I don't have time. But if you're driving, or if you're trimming hedges, or doing something that takes time, really, he's a really good interview, has great guests, and he interviewed Elon Musk. And they talked about this sort of stuff. And you know, he was very sort of pessimistic about the human species in the future. I think he didn't want to sort of promote his company as the savior for all this. He didn't bring up Neuralink, but he did discuss the technology sort of in general, that there's a possibility. But it'll be an interesting future if you fast forward 25 years out. So here you go. Here's the scientist talking to his AI machine, and the machine is promising, sure, I promise, you can hook me up to the internet now, and you see what he's teaching him. Good, cure cancer. Bad, take over the world. That's where we'll leave it. So any questions? We probably only have a few minutes. Any questions, comments?
No, I think I found interesting what you're saying in terms of, you know, where this technology is going. Right now, you go to the emergency room in the middle of the night, you have an issue. They're doing this CAT scan. The radiologist is not sitting there, by the way, and the radiologist is at home. He's getting these images, by the way, fed to him from a server at home. I mean, this technology gets more enhanced. These images are going to become more and more clear, more easier to read, easier, faster diagnosis. In addition to that, you have neurological patients who have chronic pain syndrome, diabetic amputees. Right now they're putting chips, by the way, in the stumps of these patients who have been, you know, and you're getting cell phones controlling, by the way, electronic impulses to control pain.
Yeah, it's going to happen. I mean, as computers become smaller, more powerful, and your Moore's law, right? You know, doubles in power and half the price from year to year. And the Internet of Things is not going away. There probably isn't a person in this room that doesn't have some sort of Wi-Fi device in their home, whether it's a camera or a thermostat, you know, or some other, an Alexa or Google Home, right? Anybody that does not have a Wi-Fi or a lock, a light, it's got. And I think there's no one here who doesn't have that. And think about 5 years ago, it was probably unheard of. They'd have a Wi-Fi cameras in your home. I remember spending a fortune when I lived in Virginia on cameras, you know, wired cameras. Now, Arlo, I recommend Arlo. I'll go on record. Use Arlo. Very inexpensive. They store a week's worth of video for you for free. So you go back and see all your videos. They're wireless, they work great. I mean, compared to what even 2 or 3 years ago, what people would spend on security cameras for their home. it's not going away.
This month's issue of Scientific America, talking about this neural work, they had a interesting article about being able to predict for epileptic patients when a seizure will occur. So it's really remarkable. The question for you is on the IoT, IOMT, is that going to download to say like an EMR so that way it would be right?
I mean, yeah, I mean, that's the thought. I mean, the idea is to be able, the caveat is that, you know, integrating with EMRs can be difficult, particularly Epic. I don't know if you've ever had experience with Epic's health hospital system, but some of them are still pretty proprietary. But I think, you know, once one does this, once you have a few vendors working with some popular IMOT, whether it's epilepsy or something else, I mean, they'll all have to do it. They'll all have to integrate with these devices to build really a continuous longitudinal record of data for that patient, you know? And I can't imagine why it wouldn't all be stored. I mean, it's not, storage is cheap. You'd be shocked what you could store in a cloud today. Processing gets expensive with Microsoft and AWS. The storage is pennies, really inexpensive.
I see a real benefit here for people on clinical trials, that you get real-time information to the clinical investigators.
Yeah, I mean, what's better than that? What's better than asking someone to fill out a form or remember, you know, what if they, was I nauseous 3 weeks ago, 2 weeks ago? Like, how many times was I nauseous? I can't remember. But if you have, even if you can't detect the nausea, if you have a device that you just hit a button, yeah, I'm nauseous now. You record, yes, sir.
This is
Clarence, right?
Yeah,
Yeah,
this is
he's
pursuant to something you had mentioned earlier. We went to a lecture earlier, well, last week, and it had to be about 911, enhanced 911 in Nassau County. What you do is you pre-enroll with your phone number and you tell them everything that's wrong with you, whatever it is. So if they get a call, they show up with the right equipment.
Oh, interesting. So if somebody has some COPD, some breathing problem, or epilepsy, they know when you're calling 911, they got a COPD patient or an epileptic patient or whatever.
Yeah, even if you can't speak, but the fact that the call came from your
Or
phone.
you have a history of stroke or something, yeah, that's very interesting. That's something that they're thinking about?
It's in effect now.
Oh, really?
Nassau County, you enroll in it,
I gotta check that out. I don't have any word yet, but a few years I probably.
and then you get the app on your phone.
Yeah, interesting. Well, my in-laws have everything. They got pacemakers, they got bypass surgery, they also.
Yeah, just stay away from the microwave.
Yeah, is that true?
I don't know.
Well, magnets, I tell them. Any other comments or questions? Sorry, we ran a little late, I guess, today.
All right.
Yes, sir.
Yeah, you can take one.
I saw that on the, I heard this on the radio, they talked about a guy who was quadriplegic, and he was able to move about robotic arm or something. I was like, thinking like, how is that possible? Well, then I was thinking that, like, you know, for years they've been putting people in MRI machines and having them perform certain activities, whether they're playing a violin or moving their arms. So it's not far-stretched to think that they're mapping these parts of the brain, lighting up different parts, and all they would need to do is implant a detector and say, hey, when this part of the brain lights up, move the arm.
That's exactly what this chip does. So actually, you should take a look at what Neuralink's home site, you know, their website, and take a look at some of the videos on there. I mean, I'm sure our good doctor here would know better than I would, but your brain creates an electronic signal, but it's analog. So this chip that they have here essentially takes the analog electrical signal from the patient and converts it to a digital signal. We've done it all the time, with modems, right? Analog modems and digital, why not? So he's taking the analog signal, electrical signal, and converting it to a computer language. Pretty amazing. I think you're going to see a lot, like, and I think even an old guy like me in our lifetimes, I think you're going to see the next 10 years. I mean, just think back 10 years, what we didn't have even 10 years ago. Another 10 years at this rate of progress, you're going to see big changes, I think. Well, thank you very much, everyone.